All right, let's dive in. Today, we're looking at something pretty specific, how one hospital presents its patient journey for treating chronic acid reflux, or GERD. We're going to follow the path they lay out, right from those first nagging symptoms all the way to what they call long-term relief.
Okay, so for most people, the whole journey kicks off right here, with symptoms that just don't seem to go away. It's that moment when you start to realize, hey, maybe this is more than just a minor inconvenience.
And that leads to the big question, right? Is that recurring discomfort you keep brushing off actually a sign of something more serious, like GERD? It's a simple question, but it totally reframes how you think about what your body is telling you.
So the hospital lays out some pretty specific signals to watch for. And what's really interesting is how specific they get. It's not just, oh, I have heartburn sometimes. They're talking about that sour taste in your mouth, trouble swallowing, or even a cough that just won't quit. These are the kinds of clues that tell you, yeah, this is probably something more than an antacid can handle.
Okay, so you've recognized the signs. Now what? Well, this is where the hospital really starts to explain its whole philosophy of care. And it's all about moving past just quieting the symptoms for a little while.
And I think this slide just nails the difference they're trying to highlight. On one side, you've got the common approach, which is basically temporary relief, just making it stop for a few hours. But on the other, you have their philosophy, which is all about digging deeper and actually fixing the root cause. It's a completely different game plan.
And to back up that philosophy, they talk about what they call ethical medical practices. And look, this isn't just some fuzzy marketing term. They get specific. It means clear communication, not ordering a bunch of tests you don't need, and really truly focusing on your long-term health. It's all about building trust right from the get-go.
So that's the big idea, the philosophy. But how does that actually look for a patient walking through the door? Well, they lay out a really clear, structured process, something that's designed to be simple and easy to follow.
And here it is, a clear 4-step pathway. It all starts with a deep dive conversation about your symptoms and lifestyle. Then comes the actual diagnosis with modern tech. From there, they build a personalized treatment plan, and this is key, it ends with long-term care to make sure the problem doesn't just come right back. This whole thing is meant to take the mystery out of the process and give you a clear roadmap.
A great plan is, well, it's just a plan, right? It's only as good as the people who actually carry it out. So let's take a look at the team and the experience that they say is the bedrock of this whole approach.
And we're not talking about a few years here. This legacy goes back more than 3 decades. They point to the founding doctors who've been at this since the 90s. And get this, one of them didn't just practice. He actually established an institute that trained over 1,600 other surgeons. I mean, that's not just doing the job, that's defining the field. And if you want to boil all that history down to one powerful number, here it is. 45 plus years of experience. That number, that belongs to Dr. Ramesh Makam. They call him a trailblazer in minimally invasive surgery. And with more than 1,000 bariatric procedures under his belt, yeah, that's not just experience, that's being a pioneer. And he's not alone. He's joined by Dr. Saraswati Ramesh, who brings over 40 years of her own experience to the table. Her expertise is incredible. We're talking over 3,000 surgeries. But it's not just about the technical skill. They also highlight her focus on holistic wellness, which really ties back to that root cause philosophy we saw earlier.
All right, so we've seen the philosophy, the plan, and the people. But what about the results? This is what the hospital points to as the ultimate proof. They basically say, look, the real measure of our success is in the stories of the people we've helped. It's all about that real-world impact. And to make that impact feel real, they share specific stories. Take Tanushri's recovery, for example. It's held up as a powerful testament to their holistic approach. And that's so smart, right? It takes all the clinical talk and turns it into a real human story of recovery. And then you've got the patient testimonials, which add another layer of social proof. Listen to this one from H.N. Ravi Kumar. What I love is the combination he mentions, skilled hands and a compassionate approach. That perfectly captures both sides of the coin, the top-notch surgical skill and that human-centered care they talked about in their philosophy. And this next one from a patient named Ashu is great because it widens the lens. The praise isn't just for the lead surgeons, it's for the entire team. All staffs are too supportive, she says. It really paints a picture of a totally supportive environment from the moment you walk in the door.
So we've walked through this whole journey, right? From the first warning signs to the philosophy, the plan, the team, and finally the patient stories. And they end it all by turning the question back to you. They ask you to think, hey, what could this kind of deep dive, root cause approach actually look like for me and my health?
And honestly, that's a pretty powerful thought to end on.